Good morning, everyone. Thank you very much for the invitation to be here. I really want to take a moment to thank the Conference Planning Committee, especially my colleague Claire Bungen, who's been so gracious. I believe that Alfonso Contreras has some responsibility in the fact that I'm here, and Hiram Arroyo also might have had something to do with the connection that we made between PAHO, UNESCO, and this conference. So I've been participating in the Charter Committee over the last couple months as well, which has been an unbelievably enriching experience. And I've been focused on trying to help my colleagues from the Latin American region get on board this train and make sure that all of you can also see what's been happening in the Latin American region. I've been invited to talk about, I think in the program it's called Health Promotion Literacy, and I've put health literacy because it's a little bit broader than just promotion. But for those of you who are wondering why UNESCO is here, which I also wondered for the first couple weeks, how we could fit in what we do with the aims of this conference. I mean, you all would surely know that the human rights mandate of the UN system is one that's shared by all the different agencies that are part of the UN family. And for UNESCO, the right to education for all under any circumstances is our flagship. It's our core mandate. We've been working for decades in the area of literacy, promotion, rights, socioeconomic development. Personally, I work most intensively on HIV issues, sexuality, and health education. And we also have a big focus on gender-based violence in the school setting, particularly homophobia and transphobia. A lot of our work is, especially in HIV, we're faced with the challenge of how to prove what we do matters, especially when we're measured, our health education efforts are measured with biomedical indicators as supposedly the results of our work, which is quite complicated for education people when we're talking about the construction of competencies through basic, secondary, and tertiary education, and also the concept of literacy over the life course. Oops, you're in charge of advancing. Thank you. The health and education relationship is a well-established one. The impact of educational levels on health status is undeniable, but nonetheless, it's a complicated relationship. The two different sectors work with very different time frames, different measures of success, the visions of change that happen. Doctors cure individual patients, and teachers build generations. We're both faced with new challenges around chronic diseases and healthy lifestyles in a social context that's just filled with all kinds of contradictions. The messages that we all get through the media about what we should be eating, what we shouldn't be eating, all kinds of things. Should we run? Should we jog? Should we sit on the couch and play video games? It's a mass of contradictions that when we talk about health education, we need to bear in mind. And for some, especially younger people, the capacity to sort through all of these messages with the appropriate information and the competencies to make decisions based on it is actually, in some cases, a matter of survival. John. Let's talk about education for a minute. We've had an enormous expansion of access to education at all levels in the world over the past several decades alone, including at tertiary level in higher education. But nonetheless, in so many countries in the world, we hear that almost all aspects of education are in some kind of crisis, whether it's equity and access, whether it's if students are learning the right things, whether teachers are teaching the right things, are they focused on the correct things? What about the quality? We've had this enormous explosion of colleges, universities, privatized secondary and basic education. Do we have the means to guarantee that any standards of quality are shared among all of these relatively new actors, especially when we bear in mind the market influence on the establishment of some of these on many of these new institutions, and the structure, whether it's financing, what the role of the state is, how much freedom we can give the market to determine what happens, bearing in mind autonomy of academic institutions. We know that the soft skills that students acquire in education systems are probably far more important to employers, at least in the first couple years, than are whether or not we remember what a quadratic equation is, or if we can remember the periodic table by heart. What I mentioned at the beginning, our measures of success between health and education are quite different, because more and more we put the focus on standardized tests in math, language, and sciences, when even though we know that it's the soft skills and the competencies and the ability to learn how to learn are what really matters. Next one, please. Through a lot of these considerations, in a story that I don't have time enough to tell you, we've been reviewing, and when I say we, a group of colleagues from a number of different universities in the region, to come to this definition of health literacy that is based on a group of European universities that have applied a big study in 8 different countries in Europe. And the reason this was attractive to UNESCO, especially when health literacy is very much in its origins a clinical concept relating to the quality of the doctor-patient relationship, this definition of health literacy and the work that's been done around it starts to get at these competencies that I mentioned. It's focused on also the knowledge and motivation that we need to ensure that people have to access, understand, appraise, and apply the information that they're getting from all different kinds of sources in order to be able to manage their own health, but also not only when they're sick, but to prevent diseases, and also to take on a more social activist role in the promotion of health among their intimate circles, in their families, in their communities, and UNESCO, WHO, and PAHO, together with our member states at a national and global level, to improve the quality of life through the life course. Let's talk about literacy for a second, because a lot of people know UNESCO for its work in literacy. Go ahead, Johnny. Johnny? When we first started talking about literacy, it was really about making sure that people knew how to read and write and do basic mathematical operations. We, of course, know that this concept of literacy is outdated, and it's much more than that now. This is the official definition that most countries use in terms of how do they measure how many people are literate and how many people still have to go. And this dates from 1978. And we start to get at this competency issues here in terms of the capacity to engage in all of the activities for which literacy is required to enable this basic interaction that people must have within their groups and their communities, and the abilities that are largely based on the written word, writing and calculation for his or her own development, or for the community at large. There's lots of different approaches to literacy. It's, of course, the cognitive skills, the capacity to apply it within a set of certain political, cultural, and social and linguistic contexts, the capacity to use these abilities applied to specific goals, and using tools that enable us to reflect and think about social change. I'm going fast now. Health literacy is comprised of all of these concepts and skills. I won't go through these all now, but I put it in lots of colors so you can see the variety of things that we must take into account when we're talking about health literacy. It has a lot to do with the media, one's own personal skills, the capacity to solve problems, to even recognize problems, and make it relevant to one's own life. We really view the health literacy framework as both a really useful instrument to know where we are in terms of measurement and analyze the differences that there are between different groups. We see it as a framework for both personal empowerment, but also with this more political dimension that enables us to talk about community empowerment. And really where we want to go with this is make health literacy a tool where we can talk about what's needed for effective public policy in both the health sector and education. And of course, universities have a huge role to play in this as a setting for knowledge creation, knowledge sharing, and this extension to the broader community that Deborah talked about a minute ago. Let's talk about higher education for just a second. Go ahead, Johnny. I just want to remind you, and Casey mentioned this again, that access to higher education is by no means guaranteed or global. This column represents the gross enrollment ratio in higher education in North America and Western Europe, which reaches about 61%. You can see huge variations from 60% on down through Central and Eastern Asia. Here's Latin America in the Caribbean, which is just over 20%. Central Asia at 20, the Arab states at 16, all the way down to Sub-Saharan Africa at not even 4. So I think one of the first important things to bear in mind, like Casey mentioned, is that access to higher education is a privilege, and it's by no means a right guaranteed by anyone. I think it's an important issue to bear in mind, and during the discussions we're having here, that although so much of this conference is focused on the really important aspects of how to ensure that the conditions within universities are what they need to be for sustainability and all the other issues that universities have to deal with. Outside North America and Western Europe, we're only talking about a relatively significant minority of young people accessing higher education in the first place. Go ahead. This is a chart from the OECD about the kind of students that are arriving at university. And this is also another issue that we need to bear in mind. This is based on PISA, which is a standardized test of math and sciences in this case. This line is 50%. So we can see that all of these countries that are beyond 50%, these are students who are not meeting the basic requirements upon exiting secondary school with basic skills, in this case measured in just math and science. Ghana is almost 90%. Here's Colombia at just over 70%. Albania is doing a little better, just over 60%. All the way on down, here's Chile with just under 50%. All the way in here you see start to see more of the European countries. If I can find Canada, I'm sure it's right at the top of the list. Here's Canada with just over, let's say, 12% of students not acquiring skills when they're leaving the secondary system. We can see that the universe that we're dealing with that enter universities in so many countries, we still have a lot of work to do. Let's go on, Johnny. What do we expect from education? Obviously, the PISA math and science scores. I think you would think the whole system is structured so we could assume that that part of the piece is done, because so much of what we expect from education goes well beyond math and science, doesn't it? We're hoping for, of course, the practical knowledge and the theory behind it, but we also want to ensure that people have the critical thinking skills and not just the information, this part of health literacy that I mentioned, the self-awareness to be able to determine how much of it is relevant and what isn't to one's personal life in a broader context of citizenship, whether it's the community, the university community, the larger society, and the world. I think this is my last one, Johnny. What do we expect from health promoting universities in this context of this body of competencies that we want to ensure that people, while they're in universities and leaving a health promoting university, what they need to have, what this context needs to be? Well, first of all, and at the basic root of it all, is a fundamental commitment to the promotion of health and well-being for all. The commitment to knowledge generation, an advocacy, an active leadership role, a passion for rights, equity, and participation in all of its activities. This meaningful involvement with broader communities, the commitment to knowledge sharing, technical excellence, and the evidence base, and of course, healthy campuses. I put healthy campuses as at the same level as everything else. I know it's a really important focus of this conference, but I did want to put it in this broader context of so many other issues that are pending in so many countries in the world. So we have the biggest macro view and the most diverse view that we can during this conference, and that will be it. Thank you. One more thing. Last one, Casey. This is Santiago de Chile, where I live, on a remarkably and very rare smog-free day. You may have seen in the news that we're suffering a huge pollution crisis in the past couple weeks because it doesn't rain anymore, and the rain doesn't come to clean up the smog, and which is, we have a really terrible situation right now with, for example, physical education classes being canceled all over the city by law because we can't possibly promote physical activity when the air quality is as bad as it is, and it just gets worse and worse. So sustainability, education, healthy cities is also a huge part of what we need to do. And that's it. Thank you.